I don't feel alone. We just settled in and it already feels like home.
You're listening to the Feels Like Home podcast with Mike Throne and Marty Ford.
Hey everybody, it's Marty and welcome to the podcast. This week we had an opportunity to sit down with Dr. John Gabis. He's the Medical Director of Community Partnerships for Adena Health Systems, and that's a new position for him. And he comes in and shares basically the last 15 years of his life as a doctor in our area and the challenges that we've faced as a community during the opioid pandemic. And we also touch on his new position and the exciting things that he's doing in the community and bringing partnerships together with organizations to help kind of battle some of these socioeconomic challenges that we have from a grassroots level. So we're excited to hear his story. We're excited to share his story with you, and just a wonderful interview. So we'll jump in right now with Dr. John Gabis.
So we're really excited this week to welcome my personal physician to the program. He is not going to give a report on me by my request, and he has to abide by my HIPAA request. So
that's true.
This is true.
So that's great. But Dr. John Gabis is, I'm probably going to embarrass him. So he is literally one of my favorite people in all of Chillicothe. I like to call him my favorite human in Chillicothe because he is such an amazing human. Has been a friend to me as a doctor when I needed a friend, and been a doctor to me when I needed a doctor, and a partner in crime. Not crime. I can't say crime.
No,
a partner in community for me when we've been partnered together on the opiate issue and now with some community things. And one of the great blessings of my life in coming to Chillicothe was drawing the straw that had Dr. Gabis as my personal physician, because it began a relationship that far transcends doctor-patient. And so I'm really excited to have you on. You were one of the people that I targeted. You can ask Marty. I targeted you as one of the people to bring on right away because to me, you encompass everything about my experience in Chillicothe. So with all that said, welcome.
Well, thank you. Thank you for those kind words.
Yeah, no, it's just been a blessing, you know.
Great.
And I think I know that, and we're going to get into some of this stuff too. But I'm interested because I'm a transplant to Chillicothe. You are a transplant to Chillicothe, so I'm interested in the backstory of how a guy from Steubenville, Ohio, ends up in Chillicothe, Ohio, and what all that means. Obviously, it has to do with your profession, but it's more than that, though. I think.
Yes, it is more than that, because when I was in school at Ohio University, I would come through Chillicothe either on the bus or in my car on my way to Cincinnati to visit my brothers. So I would come through here, and I love Ohio history, and really I love the canal period of Ohio history, and the first Capitol, and the first land office in the Northwest Territory was in Steubenville. Mm-hmm. And learning about Chillicothe and it was always someplace that I really felt an affinity for. So I graduate from college. I go to medical school in Dayton at Wright State. I go away for a year to South Carolina to study family medicine. Decided really I need to be back in Ohio. Finished up at Miami Valley in Dayton in my residency, and then I was the second year resident out of 3 years. I was in my second year, and I was the guy who put the job offers up on the bulletin board. And there was one that said Chillicothe, Ohio. And I said, well, maybe I should go check this out.
Did you pocket that one and not post it?
I didn't. I put it in my pocket, and I didn't if I were to review it and say, no, I'm not going there, then I would have posted it.
Back on the bulletin board.
But I met Dr. Paul McCarter, and it was like I had known him my entire life. we were professional soulmates. So here's the dichotomy. He was 69, I was 30. He had short hair, I had long hair. He is a Methodist, I'm a Catholic. He's a Republican, I'm a Democrat. But it was like we were the same person, even with those differences. So Paul McCarter is the reason I came here. Came over and interviewed, and he had another physician in with him, and he was 69. He was going to retire soon, and I didn't want to have him retire and have me practice with the physician who was in his practice at that time. So I wrote him a letter and said, "Thanks for the great visit. I'm sorry, but I have to decline. If anything changes, please call." And a few weeks later, I get a phone call. And we'll be over next weekend. So we came back, looked around, and it was pure magic. I've had two fathers in my life, my biological father, whom I loved, and Paul McCarter, who I loved as a father.
Yeah.
And it was just a very special relationship.
And I can say this because I am your patient, but the more people that I talk to that are your patients or have been your patients, every one of them speaks to your manner and the way that you handled them. I can say specifically, I'll delve into an intensely personal situation, and you know this one because we talk about it a lot. But when I was going through my divorce and I lost 35 pounds, I walked in for my regular checkup, and you came in and tossed the file on the table and just said, "What is going on with you?" Because there's one of two things. And if it's one thing, we need to talk about that, but there's a whole other conversation that may take place. So I think what people really enjoy about being your patient is you are a human first and kind of a doctor second. I don't know if that makes even any sense, but
I like to say I'm just a regular guy who happens to be a doctor.
Yeah.
And it's really important to me to form those connections with people that I interact with. So whether it's as a doctor-patient relationship, or I've heard some stories about how as coroner I made something very, very bad be not quite so bad.
Yeah.
And really I serve our Creator, and that's where my desire to do a really good job comes from.
Yeah.
And I love my patients. And it's a funny thing because doctors don't usually say, "I love you," or, but I found that I was a little uncomfortable when I first came, and I was a young doctor, and people would say, "Well, love you, Dr. Gabis." And I would kind of shimmy a little bit and say, "What am I supposed to say?"
Right.
And I would say, first I would say thanks. But then as I got more comfortable, I would say, "I love you too." And now it's not unusual for me to say it first.
Right.
Because it's that love of another that inspires you to give your all. And that's that may be a fault in giving your all. You don't reserve things that you need to reserve for your family sometimes, but that's the only way I know how to do it.
So let me ask you, where does that come from? Because obviously not all doctors have that. Did you grow up in a family that sort of was more nurturing, and so therefore that made you more of a nurturer, or how did that work?
I wouldn't say it was overly nurturing, not in a bad way, of course. Sure. But I saw service in my siblings, and I saw service in my parents. We went to a Catholic grade school and high school, and my dad helped to build an addition to the school. He helped to do things around the church and the school, and my mom volunteered. My mom and one of my brothers actually graduated from college at the same time. My mom had 9 kids, and in 1970 she graduated from college, going to night school, raising 9. Some of the kids were out of the house, but she was working, going to school, raising a family.
Yeah.
And the drive for education comes from her. But it was just, I was born this way, sensitive to a degree, but I remember as a kid, we would drive by people who, it was cold out and they had not good coats on. And I remember getting choked up over that. I was a little kid.
Yeah.
So I didn't do anything to start it. I just kind of ran with it and developed it.
Yeah. You mentioned your work as coroner. You served as coroner for
26 years.
26 years, and that obviously is an arduous job. A lot of people don't think about it that way, but you're meeting a lot of people in their worst moments. Anything from something criminal to something accidental, and then of course one of the things that I think became your hallmark at sort of toward the end was you were one of the first coroners in the state to kind of sound the alarm on opiates, and I think along with your colleague in Portsmouth and a few others, just really saying we've got a big issue at play here. We need to start paying attention to these powerful painkillers that are creating addicts and creating people that die. And so I'm interested in that because I remember living that through with you through your work there, and I think it helped our community, but it took some time.
Yes, it did. Whenever you come from that caring background, you can't stand by and watch things happen. You can't. For me, anyway, I couldn't just stand by and count bodies. That wasn't what I was about. That's not what I'm about. And in 2009, we started seeing unusually young people dying, and we didn't always do toxicology. Well, we started in 2009,
right,
for sure. And as this was breaking, there were pill mills in Portsmouth, Wheelersburg, Russell, Kentucky, South Shore, Kentucky, and people were going there getting these huge amounts of narcotics. And some people were dying from that. There was a doctor in just south of Chillicothe, Dr. Paul Volkman, who was probably the king of pill mills. And I don't think people around here realize how egregious his prescribing was. And it's really not prescribing, it's legal drug pushing. Mm-hmm. And as this developed, I saw more and more people who were possessed by this demon, because it takes over your life and you're not living your life for yourself. You're living it for your addiction, for getting more drugs somehow, somewhere, some way.
Yeah.
So 2009, it was like, wow, we're starting to see something here. 2010, we are seeing something here, and we've got to do something about it, because we're going to lose an entire generation if we don't. So when you think about it, well, why is it happening in Southern Ohio? Why is it happening here? And when you look at Appalachia, poverty plays a role, educational levels play a role, family history of substance abuse plays a big role. Yep. And kids see it when they're young, and they adopt a lifestyle like that. But there's also a lot of pain that goes with that. And if you take a narcotic and you feel normal, why in the world wouldn't you want to do that more often?
Right.
When you think of that.
Especially when the pain goes away, right?
Yeah. Or I've felt unworthy, I felt unloved, and this narcotic pain medicine helps me to feel normal.
Right.
And why, if I felt abnormal for 18 years and I took some medicine, maybe one or two extras, and I felt normal, why wouldn't I do that? Because it dulled the pain. So that's how people get started down the path. We've heard stories about people who broke their leg, and they were prescribed pain medicine, and they became addicted. Well, most people didn't become addicted. Most people who have a predetermined penchant for that, they abused their first prescription.
Right.
because it made them feel like a better person. I know that there's nothing logical about addiction. It's irrational. It's not, we'll just decide to quit. It's not quite like that. Your brain is rewired, and it becomes dependent physically and socially and psychologically and spiritually on these substances.
Yeah.
So that was 2010. And I knew that I was the coroner. I shouldn't be leading this. I'm just paying attention here and sounding the alarm. But like I said, I can't stand by and watch things. So I asked people to come together in the first iteration of what's now the Hope Partnership Project. It was the Ross County Coalition Against Drug Abuse. And we had some pretty amazing people there who were thinking outside the box. So I would joke at the beginning of the meetings, I would say, leave your egos at the door, but bring your budgets. So that we had a way to, if we were trying to accomplish something, we needed resources. So here's a great example. Terry Minnie, who was our first coordinator, she at that time worked for the Adult Parole Authority, and she had the budget and the ability and the authority to get a urine drug screen on any parolee in Ross County. So we were answering the question, we think we're dealing with this, opiates, oxycodone mostly, hydrocodone, but also that was the beginning of black tar heroin. Are we chasing the right thing? Are we sure that this is what we're dealing with? We proved that. Yes, as a matter of fact, that's what we were dealing with. So then the State Highway Patrol was a member of the coalition. They brought their public relations budget, and they had graphic designers who could help us design brochures and banners for drug takebacks. So it was a coming together of lots of people. Another key player at that time was Job and Family Services, seeing the number of children in foster care go up dramatically. They were an important partner at the table. So we did important things, and I was talking to Wayne McLaughlin, who was then the leader of the Community Action Commission, and he said, "Doc, this is all great to talk about it, but we got to do something." And I saw him just the other day, and I told that story, and I said, I hear that all the time in my head. We can't just talk about it. We have to do something. So I knew that if we didn't do something about the opioid issue that was growing larger and larger every day, it was going to impact our community. And as a family physician, I feel like I care for the community.
Right.
So the drive was to make sure that we had some kind of response to this, and that we weren't just going to let it happen to us. If people in Appalachia or anything, they're pretty resilient. So how did we needed to figure out a way to get people to say, this is not who we are. This is not how we live. We're going to make a difference. So gradually we were making some inroads. And one of the hard things about dealing with the opiate crisis, how do you know you're making headway?
Right.
We don't want to count bodies at the end of the year.
Yeah.
How do you know you're making headway? So one of the things that we came up with was how many doses of Narcan were distributed to the community, and how many deaths were there. And we saw a flattening of the curve a little bit when Narcan, or naloxone is the generic name, was accepted in the community. It was a hard sell at first.
Yep.
Because you give this stuff to people, you're going to enable them to keep using. Well, if they're dead, there's no hope. So they wouldn't use anymore. But if you had a mechanism to keep them alive and they were breathing, there was hope. If they weren't breathing, there's no hope. And when you look at mothers and fathers, whenever you talk to them about why their son, daughter, grandson, granddaughter died, they're people just like us.
Yeah. Yeah.
They're just like us, and they're going through this, and we have to do something. That's a common theme. You just can't sit back. You got to do something. So Narcan became more palatable. I would think that's a good word. And we were able to get more and more of that into the community. And law enforcement has been an outstanding partner. Yeah. They adopted the law enforcement officers having Narcan with them because often they're the first responders.
Right.
So if it's in the city, Medic 3 and Medic 4 and Medic 1 might be out at the hospital. And Chillicothe Police are the first on the scene.
Yeah.
They saved lives. They saved a lot of lives. Mm-hmm. And in the sheriff's department, the response time of volunteer squad units, it can be a long time. And these sheriff's deputies, they helped save many, many lives as well.
Do you think that that's is that the moment that the tide started to turn a little bit with the availability of Narcan? Like you said, you really had to sell. You didn't have to sell the addicts on Narcan. You had to sell the families of them, right? And the community. The community.
Yeah, you had to destigmatize the use of it.
Yeah,
right.
In order to sort of open the door,
right,
for folks to say, okay, you're right. There's hope if they are still breathing.
Yeah.
So, like, if you looked at one thing that really made a huge impact, that Narcan
availability of Narcan.
Yeah. Wow.
But now the story changes.
Okay.
In 2013, we start seeing higher overdose deaths rates in Chillicothe, and the drug that showed up was fentanyl, and it's a very, very potent opiate pain medicine, and people use it in medicine all the time. And this wasn't stuff that was being stolen out of pharmacies, or it wasn't stuff that was, people weren't stealing it from the hospital. This is stuff made in Mexico and China coming across the border through Mexico and some from Canada and getting into the heroin. And that was an absolute game changer. So it takes more Narcan to reverse fentanyl than it does black tar heroin or any kind of form of heroin. So thank goodness we had Narcan in the community, because it took a lot of Narcan to keep the death rate down. Wow. So, Mike, you brought up a good point about stigma. This disease, opioid use disorder, this disease can happen to anybody in any family. It's not those people over there. It's people I know that you know, and Marty, that have struggled with this. And when you stop judging about the why, and it's very similar to HIV. It was a gay man's disease in the 80s.
Right.
And people would say they're getting what they deserve. Well, nobody deserves that, no. And nobody deserves to die because they have an opioid use disorder.
No.
I feel like the pandemic has changed some of that as well. Like, just like people's mentality towards it. Nobody's safe from COVID, right? Like people that every day that you live your life with they were contracting COVID. And so I think it's taking that same, maybe that's helped people understand the opiate addiction problem that we have make that a little more palatable, or I don't know.
And I know it sounds like we're dwelling on negative stuff, but really there are positive pockets here where the community didn't let it just get swept under the rug. When Jack Everson was mayor, he reconvened the Drug Abuse Coalition. I backed out because the coroner shouldn't be leading something like this.
Right.
And it kind of went dormant a little bit. And then when Jack put his program together, I was happily back involved. And then in 2015, we got a grant from the Office of Criminal Justice Services from the state to help develop some infrastructure, particularly a coordinator. We were all meeting, having great ideas, and Wayne McLaughlin's in my head saying, we got to do something. And I'm going back to my 60-hour-a-week job, and there was nobody there to put it together and make sure it got done.
Yeah, put it to action.
Right. So when we got the heroin partnership grant, that's where our name came from.
Right.
Was from the grant. That was a big turning point. Judge Ader was a key player in obtaining that, and I'll be forever grateful for him for that, and for developing the special docket of a drug court.
Yep.
So we couldn't arrest our way out of this problem. We couldn't prosecute our way out of this problem. The number of breaking and enterings and distributing stolen goods or receiving stolen goods, the dockets got so full of drug-related offenses that it clogged everything up. So if I were somebody who was driven by a demon to do these things, and I had a chance to say, I understand that I have a disease, I need some help. And lo and behold, it's the court system that's going to help me. And thank goodness that Judge Yater was forward-thinking and able to put that together, along with his staff. That also was a game changer. We could feel the stigma changing a bit with that. And then when you meet some of the people who have gone through that, it's like they're back from the dead.
Right.
Yeah.
You know, and it's funny, in North Carolina, Project Dawn, that we call in Ohio, Death Avoidance with Naloxone, DAWN. In North Carolina, when it was started, it was called Project Lazarus, as though people were being raised from the dead. Right. And if you've ever watched police body camera footage of somebody getting Narcan, they are coming back from the dead.
Yep.
Yeah.
So
I think the hallmark of that, though, is kind of what you said, and you've kind of outlined it. It's the community coming together and just saying, we've had enough of this. We're not, I can only speak for my own self. We just got sick of reporting on death. And I said that to Dave Huggins when he was here. And I think it's the same thing. Like, we can only write so many stories about the body count before you're just like, why are we just doing all this bad news? And I think everybody kind of got that same feeling. Like, Judge Yater, I think, probably was like, I can't just keep sentencing people and sending people away. We've got to figure out how to reclaim them as human beings,
right.
and put them in the right direction. I think for law enforcement's part, I think it's evolved even more to how do we get these people to treatment now, which is
straight from the street.
Yeah, another game changer.
Yeah.
So really the hallmark of all that is just how we pulled together and just got fed up enough to do something to kind of heed Wayne's, call to action.
Yeah. And the law enforcement entities, the State Patrol, the Chillicothe Police, and the Ross County Sheriff's Office, they had to be willing to be out of their comfort zone with carrying Narcan and then trying to find, we're arresting the same people. Can we get them into treatment so they get their lives back, and we can work on keeping the community safer. So they're just, and hopefully folks are getting the idea that this isn't about me. It is no way about me. This is about how we were able to work together to accomplish this. And then we would be remiss if we didn't touch on the missing women.
Yeah.
And I don't know how many people ask me, so do we have a serial killer in Ross County?
Right.
And depending on who it was in my relationship with them, I would say, yeah, we do. His name is heroin.
Yeah.
Yeah.
Yep, right.
People get sucked into that lifestyle, and they one way to trade for drugs is sex.
Mm-hmm.
Yeah.
And many of these folks, that's how they survive to get their next set of injectable drugs or pills.
Yeah.
So whenever we had the missing women, it was scary.
Yeah.
And we did have a serial killer, and it was black tar heroin.
Yeah.
And what it did to their lives. So I'm glad that's over. And I know those families still hurt, but I'm glad it's over. And I'm glad we have some pathways for those people to get healed.
Right.
And to heal, and for the families to heal. Gee whiz, when you think about Job and Family Services now, the number of kids in foster care, I don't know the exact number, but it is way higher now than it's ever been.
Sure.
And their budget, they went, I think the director told me they went $1.5 to $2 million over budget in foster care in our region in 1 year. Imagine. So it doesn't affect just the person who has opioid use disorder.
Yeah.
It affects generations.
Yep.
And the kids that are in school are often being raised by their grandparents.
Yeah.
Because either one or both of their parents have died, they're in jail, or they're missing. You know, they've just kind of gone off the grid. So now that we're getting some infrastructure and we're opening more treatment beds, not we, the community,
Yeah.
it is the we, are opening more treatment beds, there's a sense of, okay, I have a path. And one of the things that is really important is if you get through it, if you get through this crisis and we bring you to it, you need a job.
Right.
And I think the next step for our community is to get these folks who are in medium to long-term recovery, how do we get them back to work so that they're now productive citizens?
Yeah.
Because that's part of their recovery, right? I mean, it's having that emotional feeling like they can be productive and make an impact, provide for their families, those kind of things, which helps keep them.
Yeah, and it's
from relapsing.
so easy to fall back into bad habits if you can't point to a job, you can't
Right.
point to a structure that you have every day.
What's the use? I might as well go back to using. At least I didn't feel anything. So the relapse rate at times can be high versus other types of substances. So as we talk about this, there are good things that are happening. The Hope Partnership Project, we changed our name from the Heroin Partnership Project because we got tired of looking backwards. We kept looking in the past and saying, holy guacamole, man, we don't want to go back there. So hope, the word hope gives you that sense of expectation for the future, something better.
Yeah.
And it was a palpable change in the environment at our meetings when we changed our name and said, we're the Hope Partnership Project. Because it's a long, hard slog, and we were tired, all of us.
Yeah.
And by changing the name, we changed our whole persona, and that was a big deal.
Nice recharge from that.
Yeah.
So we're not reporting on how many deaths we had last month in the papers anymore. We've changed the name of the partnership project, things like that. I think there's a want and a desire for people to think that we're kind of beyond it all now. What are your thoughts on that? And what would you recommend that we do sort of moving forward to try to keep the pressure on, to keep things moving in the right direction?
Well, that's a great question, and I do have thoughts, and I have data as well. So the pandemic has caused social isolation. And if you're somebody who is in early recovery or in recovery, that connection and community was critically important to your sustained recovery. So without the ability to be together in groups, or if I'm a service worker who works at a local restaurant and we got furloughed or laid off, you know, I'm back in a place where my brain's going a little haywire. So the number of opiate overdoses last year in 2020 was the highest we've ever had in the history of the world in Chillicothe in Ross County, 56. The previous high was 44.
Right.
And so if people think, well, the Hope Partnership Project has it under control. We do not have it under control. There's no
You don't really control something.
no.
like that.
It's a false. Yeah. It's a false sense of security and a false sense of progress. And I often end our meetings with, "Our community needs us. We cannot give up. We can never give up." And whenever methamphetamine made a resurgence, it was like, okay, now it's meth. We're okay now. No,
Right.
there's fentanyl in meth.
Yeah.
and it's so how do we help those people? And you think, I know that many people think, well, why are we spending so much time on these folks? Because we have to. Because they're our brother and our sister, our niece or nephew, our son or daughter.
They're part of our community.
Absolutely. And I know I've mentioned being judgmental earlier, but that's a key. If we're judging them, we're probably not extending ourselves to help them. So that's a key component. For me as coroner, it took a toll. My wife did not like to be seen with me in public.
Right.
Because people would come up to me and I'd start talking about it. I was keeping track of all of the deaths in my head, living it all the time. Well, that's not healthy.
No.
So I had to take a step away, like we were having a blurb on the front page of the Sunday Gazette talking about where we're at for the month. And rather than celebrating the successes, we were counting the quote unquote failures. Mm-hmm. So I think changing the name really gave us a different focus.
Yeah, I think we're not ever going to be done with this. It's not like people will stop making heroin, and the drugs that in my mind precipitated all this and caused a lot of this are still out there.
Yep.
We have some better controls on how they're prescribed, and we certainly watch out on those things a little bit better, but they're not going away. So the least we can do is continue to fight, right?
Right.
But it's also the most we can do.
Yes.
And I think that's what a lot of people don't know is like you're right. We could never go out and prosecute and sentence and arrest our way out of this. But when we had this cohesiveness about the approach to try to figure out how to create more success, that's when we started to see wins.
Yep. And Sam Quinoniz's book Dreamland, he came. It was the library of one community, one read, or backwards, one read, one community. And he was here and talked to schools, talked to physicians, talked to community leaders, and talked to the community. That was a good thing because he told us the timeline of how we got here. Mm-hmm. And we physicians play a role in that. We do. Most physicians just wanted to help, and in the marketing from the drug companies, we bought it.
Yep.
We bought it. And that was wrong. And I think we're all finding out how wrong it was. But I think many physicians were guilty of wanting to help. And so I looked on the Ohio Automated Prescription Reporting System, it's also called ORS, just the other day on the number of prescriptions prescribed in Ross County over the last several years. And it has gone down from 1-point-something million to just at 1 million. So it was like 1.5 million doses in a year down to about 1 million. And that doesn't sound like a big drop, but when you look at the graph, it's going down.
Yeah.
And it's going down all across the state. So when you're in a deep hole and you're digging yourself into a hole, what's the first thing you got to do? Stop digging.
Yeah.
Right.
So by not feeding the issue with prescription drugs, then that was a good place to start.
You mentioned in the beginning of the conversation, Mike talked about your relationship with your patients, and you mentioned that doctors had a part to play in this, and they just wanted to help. Well, I mean, I think that's what you want out of your physician, right? You want this relationship with your patient that is caring enough to say, I want to help you. I want to make you alleviate the pain or whatever you're struggling with. And so, I think it's easy to step back and say that doctors had a part in that, but I think there's something beautiful about the relationship Just hearing Mike talk about you being his doctor, and our conversation before we started about, like, as the coroner and what you did for my father, like, we don't want doctors to stop doing that.
Right.
That's
Right.
so important for patients to have a doctor who cares about their health and their well-being and looking at it holistically.
Right.
Maybe it's caused doctors to step back and just maybe even dig a little deeper in looking at these drugs and how they impact people. So,
Yeah.
from an education standpoint,
It's a different environment.
yeah,
And pendulums swing. And physicians are really good at, okay, I'm doing too much of it. I won't do any of it. I won't prescribe anything. Well, that's not the answer either.
right.
Because I would feel bad if somebody was in pain and I had a way to help them without getting them
Right.
into an addiction. I would feel so bad if I didn't do that. So there's a way. You have to be careful, and there's a time and a place to use these medicines. Make sure it's the time and the place,
Yep.
and the lowest dose for the shortest amount of time, and pay attention.
Yeah. Helping patients manage that.
Right.
Like,
And the expectation of, we're not going any higher than this, and we're not going to do this forever.
I think we did a better job as well of recognizing the connection between addiction and mental health. And I think we should at least acknowledge that part of it too. I think for a long time there was just this thought of addicts are just the same as you and me. They just can't, just all they got to do is stop. And brain chemistry is not like that for the addict. Many times there are other things at play, self-medicating from bipolar, other illnesses, mental illnesses. And I think we've done a much better job of recognizing that. And that's been incredibly helpful in this as well. Because I know several people who have been addicted and started out just sort of not, again, wanting to feel better. Mm-hmm. And self-medicating sometimes leads you to places that, I can't feel better with all the normal things that they give you for depression, anxiety, whatever. So I'm going to try whatever comes around, and I think it's a cycle, and it's a horrible cycle, but I can't blame many people that have wanted to feel better from that,
And being there when they're ready to make that commitment to return to life, to return to health. So it's important that we see each person with opioid use disorder as a human being, worthy of our love, worthy of our effort. Because if that were me, I'd want somebody reaching out to me.
Yeah.
And that's my motivation. And I know that our community is very motivated and dedicated to making it better.
Yeah.
Because we in Appalachia, we have a couple of strikes against us.
Yeah.
Poverty, education level, a lot of different things. And I think this is one of our shining points, is that our community came together to try to heal this, to try and make progress, to try and stop it from regenerating into the next generation. So each generation, it kind of has its thing. When I was a kid growing up, a lot of my friends in 8th grade were smoking dope all the time.
Right.
And as coroner, I never signed cannabis overdose, never. So it was a whole different animal. Mm-hmm. And meth is different than opioid use disorder. So it's just, there are many things that are positive that are happening in our community because we said we're not going to stand by and let this define us. So that we've talked a lot about the negative impact, but there's also this positivity that's coming back. The Carlisle building, that's where my office is now. That being the cornerstone of a renaissance, and you have families like the Rutherfords who are coming back to town, opening up a restaurant. Ben Daughters with the Poorhouse, others. You can feel it change. You can feel their hope in our community. And I've been blessed in my current role to be able to be part of the community and bring Adina's resources to the community to say, Adina can't bankroll everything. Adina can't fix everything, but we can certainly convene and facilitate and help.
Right.
And sensing that renaissance has been man, like a breath of fresh air.
Yeah. I agree. I think the really cool thing is that, again, it is not that we beat opiates. It is that we have a plan and that we are going to go after it. It is not that we got the Carlisle building done. It is that we took the Carlisle building and used it as a catalyst to do everything else that has been done, to spur entrepreneurship that, takes time sometimes. Mm-hmm. And I think that's the thing that, you infected me and I infected Marty with The Second Mountain by David Brooks. Uh-huh. So I don't know if he started reading it yet, but I did give him a copy of it. You recommended it. I bought it. I read it. And so you're kind of like, you're looking for your second mountain now. And I'm kind of on the way up on mine. And I think that what's really cool about your current role, to kind of shift gears a little bit here, is that I can't think of a better person to kind of be the community forward face to kind of help drive some of these things and to bring those resources for Adina Health System to our community to help continue this revitalization. So tell us a little bit about that role and what how your bosses have envisioned your role being, mm-hmm. and why it kind of energized you, because I know it really has become a really cool part of your next phase here.
Yep. If I had a vision, if I had a mission statement in my life, for my life, it would be, I have to make a difference. No matter what I'm doing, no matter what organization I might be with, I've got to make a difference. And through my role with the Hope Partnership Project and my role as coroner, being involved in the community, trying to make things better, it fell in my lap. I'm the medical director of community partnerships. Previously, I was president of the medical group. Before that, I was in other positions of medical group leadership. But this is my why. Why does Adina exist? Why do I participate with Adina? Because this is our community, and we're going to make it better. And it deals with things like literacy in the schools. If you have a child by the end of grade 3 and they're not reading at grade level, chances of them are dropping out of high school are 75 to 80%. Chances of them getting a good job is even higher. The chances of not getting a job is even higher. So how do we help children have healthier starts to their life? We can't medicalize everything. We can't educationalize everything, but together we can certainly impact those determinants of success in the future. So by bringing Adina's resources to issues like literacy or smoking cessation, because we're number 2 in the state for the incidence of cigarette smoking, which means that we're probably number 2 in the state for lung cancer. And guess what? There are kids who have uncontrolled asthma. Why? See number 1 and see number 2, because there's all this smoking going on. And if we're able to make an impact on a medical issue, and there's this ripple effect, that's just going to be a positive thing all the way around. And then we have our park system in the city and in the county. I don't know if you've ever been to Buzzard's Roost, but it is just an amazing thing. When you get on the rim and you look down the Paint Valley, it is just astounding. Yeah. And having that available to us gets us out, gets us more active, gets us interacting more with nature and with our beautiful city and county.
Which has proven impact on your mental health.
Absolutely.
Yep. Proven every day.
Yep. And with with the pandemic, our mental health has taken a big hit.
Yep.
So coming out of the pandemic, getting people outside, getting people moving. We have a program called Walk with the Doc, where a doc or a nurse practitioner, somebody who's an expert in their field, will come and talk about a topic and then go for a walk. I know that Mike and I have met on the street, and I have walking meetings now where whoever I'm meeting with, I'm walking around downtown, and that's helpful to me. I have to walk the talk, literally.
Yeah.
Talk the talk, literally. So by reaching out to the community in all of our 9 counties, we can make an impact on people's lives for generations. So if we're able to provide good health care in schools, if we're able to get those children's asthma conditions under control, they're going to be less absent. They're going to be more alert and ready to learn. And if we're able to provide the preventive care for them, whether it's medical or dental, or especially in behavioral health, getting those kids ready to learn is a key component to the success of our future.
Yeah, and when Quint Studer was here last year, of course, part of the conversation that we had post that visit was how the impacts that we make for pre-K kids have lasting effects. You talked about the third grade issue. We're at about a 40% clip of kids that are ready when they get to kindergarten, and that's a big issue. And I don't expect a kid to read at a third grade level when he's in kindergarten. That'd be a pretty smart kid. Mm-hmm. My kid probably didn't even do that, and he's pretty smart. But I mean, the fact of the matter is we've got to have them really ready so when they start kindergarten, they can really hit the ground running on learning. And really, health is going to play some role in that. We had that conversation with Quint when he was here. He said, well, we do these things called brain bags that we give to everybody that goes in and has a baby in our maternity wards at our hospitals in Pensacola. They get this brain bag, and it's got a book you can read when they're an infant, which it doesn't seem like it makes any sense, but it does. Mm-hmm. When they're a toddler, and then you get information about other books that you can get, Dolly Parton Imagination
Absolutely.
Library, whatever.
Absolutely.
All those things make a huge difference, that starts with a partnership between the community and the hospital that says, we're going to make sure that these brain bags go home with people, Mm-hmm. And then, you add in things like Help Me Grow and things like that help, the nurturing and the nourishing of a kid. Well, I mean, you can make a big difference in that.
You sure can. And if your child isn't ready for kindergarten and they've lived an unstructured life, the first 6 months of kindergarten are going to be teaching them to sit still, listen, follow rules, not act impulsively. So that pre-K component where we can build in healthy habits, not only healthy habits for health, but learning. I read a phrase today when I was doing some research. Pre-K and K and up to the third grade. Why is third grade so important? Because by the end of third grade, you were learning to read. Now you're reading to learn. And that's why that's such a big watershed moment, is if you can't read to learn, you're going to get left behind faster.
Yeah, you just fall behind immediately. I think the beauty of what you're describing, like in your new position, like you're attacking problems in such a positive way. And I think there's some beauty in that, like, because we're so used to attacking problems right at the problem. And now it's like heading it off at the pass. And so you have this opportunity to work in a positive manner. And
I mean, instead of us saying, hey, government, figure it out for us, and then just hand us a ready-made solution. Again, the hallmark of the last 10 years is let's just stop waiting for Washington and Columbus to do all this stuff for us.
Right.
Let's figure it out, because they're going to come up with a solution that might work in Toledo or Columbus or Dayton, but it's really unworkable for a small town like Chillicothe. So how do we figure it out on our own so that way we don't have to say to them, well, thanks, but that really doesn't work here.
Right.
Nobody knows us like us.
Yeah.
Right.
Yeah, and there's so much potential when you don't limit yourself to what your budget is.
Right.
So you may not have a great budget, but somebody else might. And how do we retool and adjust as a community to help our community grow and be healthier?
Yeah.
Because, if the Carlisle building renovation sparked a renaissance, that's only going to go so far.
Right.
We have to have the next generation of kids, the next generation of leaders coming up who say, this is my community, this is my home. We care about it. We're going to make it better.
Yeah.
And I've been talking to educators, people who are in public office, law enforcement, and everybody has concerns, but everybody also says, we can do this.
Yeah.
We can do this. And I look at Roast, look at Paper City. There's a mentoring program in both places, a little bit of a different focus. The Mighty Children's Museum.
Yeah.
Little Chillicothe has this great little resource.
Right.
Yep.
And it's all because people said, yeah, we can do this.
Yeah.
And they went and did it.
And they didn't do it by themselves. And I think the other thing that's really good about what you're doing is you're medical director of community partnerships. It's not like medical director of Adina go out and figure it out.
Right.
And to just rely on their own resources to do it. You recognize, and I think the health system in general recognizes, there are great programs going on already. How do we partner better with them to maximize their performance, to help ultimately the community? And I think that's the greatness of it. 15 years ago, you're right. I think we would have said, we'll just wait until somebody figures it out. And it'll probably come from somewhere. Columbus will figure it out for us, or, whatever. And now we're just sort of like intolerant of that. We don't want to wait.
Yeah. And sometimes, like you said, the solution is not, it's solving a problem that somebody has an idea about the problem about, if that makes any sense. We know we can, if we take the time to delve into the root causes of our problems, we have number one, we have skin in the game because it's happening around us. And number two, if we take ownership of that, we're gonna figure it out using creative methods and maybe things that we never thought would be possible in Chillicothe.
Right. The Children's Museum is a perfect example of that. That was literally multiple people having the same idea, not knowing about each other.
Yeah.
One person posting something on Facebook, bringing everybody together. And then I hate to say it was easy, but it sure seemed like it. It wasn't, I know, but it really, really came down to getting the right people in the room to get it done. And,
right.
That's really what partnerships are about.
It is. And you have to, the partnerships have to leverage the strengths of each partner and balance the weaknesses of each partner as well.
Yeah, the definition of synergy, right?
Yeah, absolutely. Great word. Yeah.
Well, thank you. We've had a couple of different situations now where we'll probably look down at the count on how long this went and think, geez, will anybody listen this deep into it? But to me, this was a fascinating conversation because really, because of our personal relationship, I think, first of all, but I think beyond that, it becomes, even if you weren't my doctor, I'd want to get to know you better so that way we could work better together on different things. And you were right. I think right before we started, I think you said, let's have a good conversation about our community. And that's exactly what has taken place.
Yeah.
So I'm looking forward to what you can bring into your new role. And I thank you for coming on. And man, let's keep changing things for the better.
That sounds great. What's the next big thing for Chillicothe?
You've been listening to
go
the
find
Feels
it
Like
and
Home
make it happen.
podcast with Mike Throne and Marty Ford.
It feels a little strange, but I don't feel alone. We just settled in and it already feels like home. Feels like home. Feels like home.